Hi everyone, I hope you had fantastic weekend. So it's Monday again, and this week it's going to be all week about the lash lift. So the whole week it's going to be split into 5 different parts because we like to keep our videos quite short. So like this, you're going to pay more attention to it. So today we're going to be talking about the patch test and about client consultation forms. So stay tuned. My name is Mirka and I'm the founder of Beauty by Mirka. Patch test is very important. By doing the patch test, you're going to find out if your client is or is not suitable for the treatment. Patch test has to be done at least 48 hours before the treatment. So you either travel to her or she can come to your salon, whichever works better for you. And you need to put a little bit of lotion behind her ear. So we're going to be using Permin, Fixing and Nourishing lotion. So all 3 lotion needs to go behind the ear, and we're also going to be using the adhesive, so you can patch test her for adhesive as well. If she's got any redness, swelling or itchiness, that means that she's having reaction and the treatment cannot be done. So the lash lift comes in 3 different packages. We've got sachets, bottles and air pump bottles. Me personally, I prefer the most air pump bottles because you've got no wastage of the product, and also it's really easy to do the patch test as well because the bottle is open already. Because it's air pumped, it lasts normally longer than the normal bottle. Now, once you open the bottle, I would use the product within roughly 3-4 months, because otherwise the product can go off quite quickly. If you are using sachets, we would highly recommend to get yourself little containers, either from one of the chemists or from one of the suppliers, and you can squeeze the whole product, 1 sachet, into that bottle or container, and that could be your patch test for every client, instead of keep opening a new sachet and then you have to bin it because your client might be booked for treatment like 1 week later or so, and the sachet will not be good anymore once it's open. And as we're going through hormonal stages, for example through the menopause or through the pregnancy, you have to patch test your client again after those stages. Also, if you change the product, you need to patch test your client for the new product. For example, we buying from one of the suppliers, and they have just recently started doing the air pumps bottles, and I have asked them if it's exactly the same lotion as the one what I've been using in a sachet, and they said no, it's completely different product. So I have to patch test my client for this product as well. While you're doing patch test, it's really important you're going to explain to your client what is actually happening on the day. So you need to explain to her she needs to lay still for 1 hour or 1.5 hours, depending what brand you are using. She needs to know what is the aftercare as well, and she needs to know what you're going to be actually doing, because I've heard stories before that as soon as the client smelled the Permin lotion, which some of the Permin lotions could be quite strong smell, that she refused to have the treatment done. So talk to your client about everything, and you know that she's happy to go ahead with the treatment. On the day of the treatment, the first thing what you're gonna do is to give her client record cards. She needs to fill it out completely, and you have to double check after her what she's written. So one of the main things what you're gonna be looking at is the date of birth. Why is that important? So you have to speak to your insurance, because here in the UK you have to be insured when you do any treatments for your paying clients. Speak to your insurance and find out what is the legal age for you to do the lash lift. I'm pretty sure that it's the age of 18, but if some of the insurance will allow you to do the treatment from the age of 16, your client may need to bring parent consent form. If she has to bring the parent consent form, then make sure you staple it to her consultation form so everything is kept together. The next thing what you're going to be looking at on your client record cards would be the things on the right hand side, which is like contraindications. So it's asking if you wear contact lenses. If the answer is yes, the contact lenses have to be removed, just in case if some of the product enters the eye, which is very unlikely, but accidents do happen. So the contact lenses have to be removed. If she's had lash lift before, then again communication with her is really important. You have to find out when was the last time she's had lash lift done, because lash lift can be done only after 6 weeks. So do not do earlier than 6 weeks, because the lashes can be over processed, okay, which is they're gonna look like they are burned. Now, another question what you're going to be looking at is, are you pregnant? I would definitely not do the treatment for pregnant ladies. However, you need to find out again with your insurance company if you can do the treatment for pregnant ladies. I'm pretty sure again they're going to say no. But if that's the case, if they say yes, I would make sure that I'm going to explain to my client that due to her hormones while she's pregnant, the lotion cannot take at all. I just remember one story. One lady has told me that she lifted her client's lashes. Her client didn't know she was pregnant back then, so she was in the early stages, and the lotion didn't take at all, so she couldn't see any difference. She was wondering, like, how is that possible? This is very, very unlikely. Anyway, after, I think she said around 3-4 days, the lady has called her and she said, I'm pregnant. So yeah, if you do have pregnant ladies, and if you are doing lash lift on a pregnant ladies, which I'm recommending not to do it, but if you are, then you may tell her upfront that the treatment may not work well on her. Okay, so in this case, I wouldn't charge clients any money. So like this, you losing your product, you're losing your money, you're losing your time. Yeah, just don't do it. Another thing is that the lady, while she's heavily pregnant, she needs to go to the toilet very often. You cannot have her laying down for 1 hour while you're doing the treatment. So she would really struggle to go to the toilet in between, because her eyes needs to be closed the whole time. So do not do the treatment for pregnant ladies. Another thing what you're going to be looking at is the date of the patch test. So you guys need to write date of the patch test and outcome of patch test. It needs to be crossed, so she didn't have any reaction. Now, another things what they are here are contraindications like cataract, eczema, glaucoma, conjunctivitis. Now, whatever she takes, you need to communicate with her. If you see anything from here up, all around on her face, then obviously you cannot go ahead with the treatment. We are not doctors, we cannot diagnose her, we're just gonna politely refuse to do the treatment. If it's anything like eczema, and you do ask her where is the eczema and she's gonna point on her leg, then obviously you can go ahead with the treatment, because that's not on the face, so that's fine. Now, if you're gonna turn it to the other side, you're gonna see a date, shield size and timings. Now, like I said before, lash lift can be done every 6 to 8 weeks, okay, not earlier than 6 weeks. Now, if you don't have booking system in your computer, if you have it in your diary, she's gonna ask you, am I ready to have another treatment done? So instead of you flicking through the diary, you can just easily find her, and then you're gonna have a look on the date when she was with you last time, and you know if she's ready to come or not. Now it says shield size. So shield size is very, very important to know why you need to do different shield size. So I'm gonna explain to you now. So these are called silicone shields. So I've got small one, as you can see, letter S, and I've got large one. Medium is in between. Now, many people are thinking when it comes to silicone shields, the size matter of the length. Yes, so they are thinking the small should be used for a small eye, because they're thinking that they are separated by this length, which is not true. Now, the silicone shields are known for large, for example this one, because it's the thickness of the silicone shield. Okay, so this one is large. Can you see how thick it is? So I'm just going to try to put my fingers in there. As you can see, it's really thick. As you can imagine, 3D picture, it stands out a little bit. So this is how it looks like. It stands out quite a lot. Now comparing to the small, so this is how the small looks like. So again, I'm gonna try to put my fingers. As you can see, it's quite thin. So that's why we need to choose wisely what silicone shield is suitable for our clients' lashes, because if you use the wrong shield, you can easily overcurl your client's lashes. If your silicone shield is too long for your client's eye, you can also cut the end, so just a little bit, you can trim the ends of the silicone shield, but don't trim it too much, because if you trim it too much, they're not going to be able to bend, especially the large silicone shield. Okay, so at the moment you can just bend it easily. If you trim it too much, it's just going to stand up like that, which is not very good when you do the lash lift. We just want it nicely contour the lash line. It's going to just copy the eye shape basically. Also, the silicone shields are super bendy, so you can just easily form them the way you want them. And when you are doing treatment for your client, I would highly recommend just bend them gently, copy the natural eyelash shape, eye shape. And it should be more into like a smiley face position instead of being a sad face, because the outer corner lashes, if this one is gently dropped down, the outer corner lashes will be pulled down and then they would be lifted. So it's just not a good look. We want them nicely lifted, especially in the outer corner. So make sure that you bend it into more like a smiley position. So how do we know if our client has got short, medium or long lashes? So I'm going to show you a trick how to find out. Place your shield onto your client's eyelid without any adhesive, and then you're going to bring the lashes up gently with your lash lift tool, or with any of the cocktail stick, or if you are an eyelash technician, you can use your tweezers. So you're just basically gonna lift the lashes up and see how far they come. So this is the medium shield size, and your lashes should come around 70% of the eyelid. So it should cover all the way up to here, okay? So that's how you know which shield you're gonna be using. If the lashes will go past this line, if they are much longer, okay, that means you need to go for bigger shield, because she needs that lift here. So you need to swap it for the large shield, and her lashes will again finish somewhere here, okay? If her lashes are very short, then you need to swap it for a small shield. Okay, so like this, you can see really nice lift. So I'm going to show you another example. Just imagine that this is my, the palm of my hand is her eyelid. So you're going to place the shield here, and you're going to bring the lashes up like this. And if she's got large shield and short lashes, those short lashes are not long enough to come all the way up. So they will go like that, but they wouldn't be long enough to be kind of like going towards up. They'd be only long enough to go that way. And like this, she is not gonna see any difference. And on the other hand, if you are using small shield for the long lashes, then again, what you're gonna do is that her lashes will be actually touching the eyelid, because they're just gonna be literally like a stuck on her eyelid. There will be no lift whatsoever. So they're gonna tickle her eyelid, and that doesn't look very good, especially if she wants to put some mascara on as well. Then she's gonna have little dots on her eyelid. So what you need to do is you need to place the large shield on her eyelid, and you see that the lashes will go first, you know, like this. I hope that makes sense. If not, then pop the comments under this video and I can explain easier. And the last thing on client consultation card is timing. So we're gonna have to write down what is the time we have been using on our client, because every lotion, every brand is different timing. So with the particular one what we are using, it's between 8 to 10 minutes. Some of them are 12 to 15 minutes, and some of them are between like 4 to 7 minutes. So yeah, depending which brand you are using, write down exactly how many minutes did you use for the perming, how many minutes have you used for the fixing lotion. So like this, you know what have been used on her, because they very often tell you, can I have exactly the same what I've had done last time? So like this, you know what was the timing, and she will get exactly the same treatment.